Okay, so hand, foot, and mouth disease. We've all heard of it, right? Most of us just kind of write it off as one of those mild things kids get. But, and this is a big but, what if I told you it can turn dangerous and fast? That's what we're going to break down in this explainer. Exactly what you need to know to keep your little ones safe.
Wow. Yeah, that quote, it really cuts right to the chase, doesn't it? Leading to death if not treated promptly. That's why we're talking about this. Look, most kids, they're going to be okay. But for some, it can get really, really serious. So the whole game is about knowing what to look for and, crucially, when to sound the alarm.
All right, let's just dive right into the scary stuff, the deadly complications, because this is what matters. See, when this thing gets bad, especially with a nasty strain called EV71, the virus isn't content to just cause a few blisters. No, it goes rogue. It can start attacking the body's most important systems.
And here they are. We're talking about inflammation of the brain, the heart muscle, fluid filling the lungs. I mean, this is serious, life-threatening stuff. But here's the kicker, the part that's honestly terrifying. This can all happen incredibly fast. We're talking between day 2 and day 5 of the illness. So it's not some slow, gradual decline. It can be a sudden, sharp turn, which is why you have to be watching so closely.
Okay, so how on earth are you supposed to know what's happening, especially when things can change so quickly? Well, doctors have a system. They grade the disease by levels. And trust me, understanding these grades is probably one of the most powerful tools you have as a parent to make sure things don't go wrong.
So just real quick, what is this thing we're fighting? It's a super contagious virus, usually one of 2 types, and it spreads through, well, everything. Saliva, blister fluid, poop, you name it. It's basically why daycares and preschools are like a perfect storm for this thing to spread like crazy.
Okay, here's that grading system. Pay close attention. Grade 1, that's the one we all know. The classic mouth sores, maybe some spots on the hands and feet. But grade 2, this is the pivot point. This is where you, the parent, need to switch into high alert. A high fever that just won't go away, your child startling or jerking a lot, that could be the virus attacking the nervous system. Grades 3 and 4, we're talking full-on life or death emergencies.
So, let's just boil it all down to this. This is the decision point. Grade 1 means you're on duty at home, monitoring, giving cuddles, keeping them hydrated. But the absolute second you suspect it might be tipping into grade 2, the rulebook changes completely. That's your cue to get professional medical help, period.
Okay, so let's get super practical. This next part is maybe the most important checklist you'll see. These are the red flags, the absolute non-negotiable signs that mean go to the hospital. Not tomorrow, not in an hour, now.
First up, the fever. And we're not talking about just any fever. We're talking a high one, 39 Celsius. That's over 102 Fahrenheit. And the key thing is, it's stubborn. You give the medicine and it just doesn't budge, or it comes right back. If that goes on for more than 2 days, it's a huge warning sign that their body is really struggling.
And here's the full list. This is your go-bag checklist. See how these tie back to what we talked about? The startling, the shakiness, walking like they're drunk? That's the brain. That's the nervous system. The heavy breathing, the pale skin, the clammy cold hands? That's the heart and lungs screaming for help. You see any of these? You don't wait. You don't see how they are in the morning. You go.
Okay, let's take a breath. Because the good news is, most of the time, you'll be dealing with a grade 1 case at home. But even then, how you care for them is super important. It's not just about making them feel better, it's about giving their body the best chance to fight this thing off, while you keep a sharp eye out for any of those danger signs.
So, here's your at-home battle plan. It's pretty straightforward, really. Number 1, symptom control. Keep that fever in check. Number 2, hydration, hydration, hydration. Those mouth sores make it hurt to drink, so you have to be relentless with water, milk, whatever you can get in them. And finally, cleanliness and isolation. Keep things sterile, don't pop the blisters, and keep them home from school. Simple, but so important.
All right, so we know how to react, we know how to care for them, but what if we could just avoid the whole mess in the first place? Let's talk about playing defense. Let's talk prevention. First thing you need to know is when the enemy is most active. In a place like Vietnam, for example, there are 2 major peak seasons. Now, this might be different where you live, but the point is, there are times of the year when your guard needs to be way, way up.
And how do you raise your guard? Well, here's the thing. There's no vaccine for this, no magic pill. Our best, and frankly, our only weapon, is good old-fashioned hygiene. Yeah, it's the boring stuff. Washing hands till they're raw, wiping down every single toy and surface. But this boring stuff, it literally saves lives.
This quote right here just sums it all up perfectly. It's a two-part mission. Pillar 1, hygiene. That's your defense. That's your wall. Pillar 2, early detection. That's your surveillance system. You need both, a strong wall and a sharp eye watching that wall for any sign of trouble.
And that brings us to this question. It's not just for today, it's for every day. Because now you know the signs, you know the strategy. You have the power to protect your family from an illness that seems common, but has the potential to be anything but. Thanks for joining me for this one.
Health is the most precious gift. If this video helped you or someone you love, please like, subscribe, and share so more families can stay safe and healthy.